Hi, my name is Robert Madigan. I'm a physical therapist and the cardiopulmonary director here at Surge in Middle Island, New York. Today, our first video, we wanted to kind of go over things for people that are suffering from COVID or recovering from COVID. We get a lot of questions from our patients, families, neighbors, coworkers all the time. What can I do to help my breathing when I have COVID? So all the exercises that we do here with our patients, or the exercises that we kind of encourage people to do, are deep breathing exercises. You need to get more air into your lungs. We know that COVID affects our pulmonary system, and we want to prevent pneumonia. So in order to do that, if we do deep breathing exercises and prone lying, we see that it helps our patients and helps people when they have COVID and recovering from COVID. So we're going to go through a couple deep breathing exercises now. I want to show you, and then I also show you what lying prone means, lying on your stomach, and different positions lying prone and breathing exercise that you can do in that position to help you, okay? So the first one for deep breathing exercise, we want to get air into our lungs, fill our lungs completely. We want to hold our breath for 4 to 5 seconds and then blow out all of our air. You want to feel your tummy get tight when you're blowing that air out so you know all the air is coming out. So I'm going to show you how we're doing it, and then on the fifth deep breath we're going to take, we're going to do a cough to try to get any mucus or anything that's inside of our lungs out, okay? So we're going to take a deep breath in through our nose, let our chest expand, feel our tummy come out, hold for 5 seconds, and then we're going to blow out. Good, we're going to do that again. Deep breath in, hold, blow out. We're going to do 2 more before our cough. Deep breath in. Feel your chest expand, tummy rise, hold, blow out. We're going to do 1 more and then we're going to cough. Deep breath in, hold, blow out, and cough. So when you're doing these exercises, it's important to allow your lungs to fully expand, let the air come in so the oxygen can diffuse inside your lungs. You want to give your lung and your lung tissue time to expand, so it's important to hold your breath for that 4 to 5 seconds. And on the last one, the 4th or 5th breath, make sure you give a cough, because at that point, any mucus that you loosened up, you can cough it out at that point, okay? The next part of this will show you in prone lying and the different breathing exercise you do, which is pretty much the same breathing exercise, but I'm going to show you how to do it in prone lying, okay? And if you have any questions in regards to any of the information you're seeing, we have a Better Breathers group. Each building in Paragon has a different day, but mine's the 3rd Wednesday of the month for Surge, and I welcome you to come on, and if you have any questions, if you want to do breathing exercises with us, or just come for our support group and education, I welcome you to come on, okay? So like we were talking about before, the importance of deep breathing. We were also talking about the importance of the prone position, lying on your stomach. The reason why this is important is that when you're sick, you tend to be on your back a lot in bed, and that's not always a good thing. What can happen is that your lungs are compressed from the weight of your body while you're lying on your back. And a lot of your lungs are in the back, and it's the compression of the weight of your body that prevents them from fully expanding. So what do you do to fix this? We lie on our stomach, proning. That's called the prone position. So I'm going to demonstrate that for you in the deep breathing exercise that we talked about before to help inflate your lungs and possibly move any mucus that you may have in your lungs. It's important to do this throughout the day. More importantly, when you're able to, sitting upright, moving, you don't want to be laying on your back all the time. That increases your risk of pneumonia, atelectasis, collapsed lung, okay? So I'll demonstrate the position for you, the deep breathing exercise, and a cough at the end. We'll do 5 deep breaths, and at the end we'll cough. And I'll show you some alternate positions, just in case you have a bad back or you can't get onto your stomach, all right? Hi, so the proning position is laying down on your stomach. So when we're in this position, it allows our lungs to inflate better, because a lot of our lungs are in our back. So when we're on our stomachs and we take a deep breath in, we can get a full inflation of our lungs. So with COVID, or anytime we're having trouble breathing, if we're lying on our stomach in bed, it'll help. What we want to do for the deep breathing exercise, we're going to take a deep breath in through our nose, hold for about 2 to 3 seconds, and then blow out. We want to blow out longer than we're inhaling. On the 5th breath, we want to cough.
After you do the breathing exercise, it's not a bad idea to stay in this position for 10, 15, 20 minutes at a time. Just allow yourself to breathe and allow those lungs to fully inflate with air. This way you can try to prevent pneumonia, atelectasis, or collapsed lung. Okay? So I'll demonstrate 5, and then on the 5th one I'm going to cough. So we're going to take a deep breath in. Hold. Blow out. Deep breath in. Hold. Blow out. And on the 5th one, you want to give it a nice cough. If you, for any reason, have a bad back, there's alternative positions for this. You could do semi-prone, which you're lying on your side with your back out. So you just want to lay flat like this, and then you can perform the exercises in this position. If that's also uncomfortable because your lower back doesn't feel supported, you can put both pillows underneath your hips to take some pressure off your lower back. And you could try in this position if that's more comfortable. The whole point is to try to allow your lungs to expand and not have the weight of your body on your lungs. So that's the prone position. I hope it helps.